history can sometimes be considered a bit of a dry subject, and it's never anyone's, very rarely is it ever anyone's favourite at school. But there are a lot of benefits to be derived from history. The main one is that we see what went before us, and we're all standing on the shoulders of giants, as they say. And so for me, dental sleep medicine, if you look at the history, can pretty much be broken or separated into 4 different eras. First era, going back pre-biblically to Egyptian times and possibly beyond, was the recognition of the importance of the airway when it came to drowning, because without re-establishment of the airway during or following a drowning, there was no way that you could ever expect to see the patient again, see the person again. So this went through various guises, but it really didn't improve very much until the advent of general anaesthesia. General anaesthesia came around at the end of the 1800s, and they were losing so many people due to loss of airway during the general anaesthetic that clearly something had to be done. Drownings paled into insignificance when you compared to the loss of life due to general anaesthetics, and it progressed more quickly, but it still took a little while, and probably it didn't really gel until the advent and the description, or the when the jaw thrust was first described. And it's often attributed to a German physician, but in actual fact, just for the record, it was actually an English dentist. But there we are, be that as it may. So that takes us to the end of the 19th century, the 1800s, and then in the early 20th century, in the 1900s, in 1903, famous French surgeon Pierre Robin, who may have been Parisian, but I can't remember, he was working with children with micrognathia, and their underdeveloped or even absent lower jaws meant that they couldn't, they had problems breathing, couldn't suckle, eat or thrive. So he described the use of an oral appliance to actually hold the jaw forwards to enable the children to do that. It wasn't another 30 years until he actually made the appliance and used the appliance, which he called the monoblock. Then there was a period of nothing much really until the early 80s, and it was 82 when the tongue retaining device, the bulb that holds the tongue forwards, was described. And then following that, which incidentally is about the time that CPAP came onto the scene. Well, it was invented in 81, but speaking from Canada, we didn't get it until 83. I, of course, was only a young boy at that time, so the thing was that nothing really happened as far as the jaw protrusion devices until later than that. And in fact, in 1995, as recently as 1995, when the American Academy of Dental Sleep Medicine came on into the picture, that's when things started picking up. And then the first proper study by Clark about comparisons of appliances, and really added the fuel that the discipline needed to come forwards. And of course now we've got over 100 different appliances, so the growth in interest in this field has been great, and you can see how for thousands of years nothing happens, and then quite incidentally something happened, and then we're sort of going up the steep bit now. And number 3 I would suggest as an era, and forgive the plug on the book, but in the early 2000, I think it was 2008, 2009, Sleep Medicine for Dentists, the Levine Sistuli and Michael Smith book was published. There may be a newer publication This is my one anyway. So, and for me, that was one of the first indicators that dental sleep medicine is not providing tongue retaining devices in edentulous patients or mandibular advancement devices in dentate patients or partially dentate patients. What we're looking at now is a larger field, whether it's bruxism, whether it's developmental changes due to airway compromise as a child, which of course has influence on orthodontics, whether it is the maintenance of your dental work, prosthodontics, restorative dentistry, and of course the impact on facial pain, TMD, and so on and so forth. So this third era or third phase, I think, brings us up to the common time, the present time, when we're sitting back and recognizing this as a true, wide-reaching, far-reaching discipline. And the reason I mentioned about 4 was because after this we've had a tremendous increase in interest in this area for numerous reasons, but suffice it to say, I think it's fair to call our 4th phase, the one that we're in now, where we're having a tremendous amount of research, tremendous amount of interest, and this is the time, without sounding salesy, but this is the time to increase awareness, not only in us but also in the general public, with physicians, because this is important. So that's a very quick rush through 3,000 years of history, but it was fairly safe because it's all happened at the end anyway. So thank you.